I'm Brendan McCormack, and welcome to the Perth Fitfam podcast, where you get to hear from the best thought leaders and change makers from across the Perth fitness scene. In today's episode, we'll be catching up with Dr. Des Menon. Des is a multifaceted research scientist with years of experience in clinical biochemistry, in a pathology lab, and in the pharmaceutical industry. He's also the founder and director of Regen. Regen is a medical research company driving the translation and understanding of medical science knowledge from research to application. Regen supports commercial health and wellness and fitness centres looking to provide a more personalised program for their members through proper scientific analysis. If you love what we do, then you can become a supporter of Perth Fitfam by joining our fan subscriptions on Facebook and gain access to exclusive content, discounts on merch and more. And make sure to give us a 5-star review on iTunes, Google Play or Stitcher for your chance to win a Perth Fitfam shirt, which will be given away at the end of every show. Thanks for tuning in. We hope you enjoy the podcast.
Yes.
Yeah.
So that's almost like a supplement company getting like GMP approved.
Yeah. But GMP is just like, do your lab meet the specifications for being a lab? So in other words, it's not a garage.
Yeah.
Yeah. So that's just that GMP or GLP for labs is GLP.
Yes.
So I used to do that for CSL.
Okay.
Yeah.
And the difference for your lab becoming that?
Well, the difference in NATA's accreditation is that you've checked all the boxes as far as making sure that the results you're getting are true, and someone else is saying that it's true. So there's some impartial ability in there as well.
Yep.
And you've got all the things to say that, look, your staff's the right staff. You haven't taken any schmo off the road. Say, hey, just come here and press this button for me, or you've followed the appropriate procedures so that your staff's getting the proper development and training. Company.
Yeah.
But from a lab perspective, that your lab's running clean and everything's following the right specific that's been set out for a proper medical lab, accredited lab. So then doctors and pathologists can say, hey, Des, you've got a lower price. Please run these for me.
Yeah, gotcha.
Yeah.
Gotcha. All right, guys, podcast 26. Dr. Des Menon. Menon?
Yes. That's right. That's right. Yep.
Awesome.
Des is fine.
So tell us a little bit about yourself. You're from ECU, which is where we're at now. So tell us about your background and what you do here.
Okay, I currently, aside from teaching, which is it's now made a compulsory thing, I also do research, but I do research specifically in medical science, and it's in a specific area. I do a lot of the molecular side of the medical science work. So should I name some examples of
Yeah,
that?
absolutely.
So I've got 2 grants that are running. One is where I look at trying to understand the molecular basis for why exercise is good for you. I mean, a lot of people know, and it's established. It's an established fact, when you exercise, you feel healthier and your body's working better. But if I asked you exactly why that is the case, you can't really boil it down to a specific thing that you've gained, because really, all the mechanisms within you, they're already there.
Yes.
But somehow exercise, what it does, it makes everything run smoother and efficiently and the way it's supposed to run.
So can you explain some of the mechanisms that you're talking about?
There are quite a few, but at a molecular level, you're looking at things like the mTOR and specific N-glycosylase reactions where you have glycoproteins or lipoproteins that are forming that are then used for signaling pathways, and the signaling pathways then, or how well they work, then effectively result in how well your metabolism works.
Mm-hmm.
So there's a lot there, and I can't, off the top of my head, remember all of them. Because with medical research at the molecular level, a lot of the research is so specific that you look at trying to prove or disprove at a particular pathway, and that's it.
Yes.
So...
And so you're saying that these are mechanisms that are naturally occurring in your body, whether you're a fit person or not, whether you're exercising or not, they're there. But then by exercising, it improves the function of them.
Well, maybe if I could give a very simple example.
Yeah, please do. I'm a simple guy.
No. Well, I'll try my best. you're born with specific mechanisms that make up your metabolism, and you know they're working because you are alive.
Yeah.
And there are mechanisms that sometimes don't work as well. Interestingly enough, there is a correlation between how unfit you are and how not well these pathways are working. Some people, their metabolism, they're more prone to certain pathways not working as well as they should, and hence they're, in a sense, more prone to particular, I suppose, propensity to be unfit or unhealthy because something's not working as well. And you only see, like, for example, if you look at type 2 diabetes, that we now realize it's a multifactorial disease. It's a chronic disease, but it arises because there are a good number of different pathways that are slightly dysfunctional. It's not just one pathway. Your body's quite resilient.
Yes.
But what we find with exercise is when you exercise and things start working the way they should, well, exercise actually encourages these pathways to work the way they should. And because of that, the body's more efficient and they're working just like they should, and you actually function better and you're actually healthier.
Cool. So in a nutshell, exercise makes you function better and makes you healthier.
It does, but we don't know why.
Yeah. Isn't that crazy? I thought, from a very simpleton outside point of view, I thought that it would have been very established as to knowing why exercise works.
At a molecular level, we don't really know. Because someone who's obese, someone who's not obese, the same pathways exist.
Yeah.
They have done twin studies. You can have, and they've done, on mice. They have experimental mice where they're exactly genetically the same.
Yeah.
And you can have different interventions. A lifestyle is like an intervention. And so if you put them through different interventions, one you might be just feeding it like crazy, and the other one's feeding a really healthy, nutritious diet, over a number of months, they look very different, even though genetically they're the same. So functionally, genetically, their metabolism's the same. And yet, what's happened because of the interventions or the difference in interventions, that's result in one being really unhealthy and morbidly obese, and the other one still maintaining its health. Yeah. And the same thing is found when the Imperial College of London looked at twin studies for humans. I just recently read a case where you had twins, and one expressed schizophrenia and the other one didn't, and yet they're both genetically identical. And it had to do with the difference in their lifestyle and what was being expressed from that.
Did you know what the difference was with the one who expressed schizophrenia?
I didn't read that far in. I'll admit to that. But like I said, what they said, the gist of it was, as in what
for instance,
biomarker?
was one a drug user and one not?
No, it wasn't that extreme. It's just very different lifestyles, as far as what we deem as acceptable in our society, being sedentary, being, not being conscious of what you're eating, as compared to being, really health conscious, where you're eating the right foods, or, in other words, having the right diet that's good for you, and having sufficient physical activity that you're promoting better metabolism. It's as simple as that. And so you had one expressing schizophrenia and the other one wasn't.
Yeah.
It's quite interesting.
Isn't that incredible? Isn't that incredible? So at the midway through last year, or at the beginning of last year, I was actually at a hospital. So a quick nutshell of what happened. I was at a hospital consulting for a company, and I was observing a stress test. So the guy on the treadmill, he obviously didn't train. I explained it like full sleeve tats, wife beater shirt, mullet. Looked like, probably a drinker, probably a smoker, just from judging, and obviously wasn't healthy, didn't train. Yeah. And the doctor looked over to me and said, okay, this patient in my field is considered a healthy male adult because he's not morbidly obese and he can walk. Yeah. And I've grown up in the fitness industry where all my friends, everyone that I speak to day to day are all fitness. So since I was 18, I've had this warped reality that like everyone sort of does it now. It's not like the early 2000s. Yeah. But it's crazy that less than 18% of Western Australians actually have a gym membership or do something active apart from walking. which means that like 82% or 80% of the population lives what you're saying in that sedentary lifestyle, which is not allowing their bodies to function.
Yes, unfortunately. It's quite sad, actually, especially in WA. We've got the beach, we've got the sun, we've got all of these things, and yet we don't have sufficient encouragement and opportunity to actually go out there and use it properly.
Yep.
I think it's sad that we are following in the same demographics as the States.
Yeah.
Where if you look at the population as a bell curve, ordinarily you have a bell curve with the dome upwards. So on either end you have the extremes with the normals in between. So you have the majority of the people being average. Then you have on one end the ones that are extremely fit and elite and healthy, and so they're a small bunch, but they're there. And then you have on the extreme opposite end, those that aren't as healthy and not so fit and all that stuff.
Yep.
And that's a normal bell-shaped curve. Mm-hmm. But what's really interesting about the States and Australia is that our curve is the other way around. So we have very little normal, but we have two extremes. On either extremes, we have a lot of them. So we have really healthy and fit people.
Yep.
We have very few that fit into the normal category, and then we've got a lot of them that also fit on the other extreme, where they're not so healthy, they're not fit, their lifestyle is just shockingly bad, and all of that. It's quite interesting.
What, from your point of view, why do you think that is?
I don't know. That's society, I think, isn't it? That's what's come of societal demand. I mean, if you go back 50 years. I doubt we sat on a chair for so long.
No.
And yet now, I spend most of my time sitting on the chair, and then I'm promoting fitness and health, but then I'm sitting on the chair for most of my time.
So I have a question for you on that. So nowadays, it's really big within the fitness space to track your NEAT or the amount of. Can you please say it for me? Non-exercise. Activity. Anyway, it's basically
non-exercise levels.
Of activity that you're experiencing. So people tracking steps and things like that, and trying to reach a goal of 10,000 steps a day. And your phone tells you all this.
These are all ways to encourage people to move.
Yeah.
But if you look at the WHO recommendations right now, it's quite interesting because right now, you can look up the WHO site. It says that sitting is a hazard. It's a health hazard.
Yes.
Sitting is now considered a health hazard.
That's funny.
Because the amount of sitting that we do, it's affecting our lives.
Yep.
And this is why you have things like, you got to stand up, walk around, a stand desk, all of these things, because the reality is our lifestyle, the way it is now, does entail a lot of sitting down and doing nothing physical.
How many steps do you think, because you've just come back from 2 12-hour days of lecturing. How many steps do you think that you'd take on one of those days? Do you monitor
I
it at all?
I don't because I used to be fitter.
Yes.
I'm not anymore. I'll add, sadly, not anymore.
So people that are listening to the audio, Des, he showed us some photos recently of a few years ago, and so you were a bodybuilder, like you were a lot of muscle and really, really good shape, and you're still in shape now. You're just not bodybuilder sort of shape.
Yeah. Well, my main sport was. I know it doesn't work in with a PhD in molecular, but I in my younger days I used to compete in full contact martial arts.
Oh, really?
Yeah.
What was it?
It was like K1.
Oh,
yeah.
So multidiscipline.
Yeah. I fought. I mean, that was the thing. I grew up with that. So it's like you.
Yes.
My lifestyle, thankfully, growing up was just don't sit around the whole day. Do something physical as well.
Yep.
It helps when you have 3 other brothers.
Yes.
So that was what we did. That was something that we all loved.
That's
probably still love it, but maybe don't do it anymore. So gym came in because I needed to make weight.
Yes.
And I didn't want to make fat weight. I needed to make muscular weight.
Of course.
So that's how. And I unfortunately, I just loved it too much.
Yep.
So I gained a lot of muscle weight. I think the heaviest I got was almost 110 at 12%. It helped because I was working in pathology by then. Yeah. So it's easy to do my own blood tests.
So that kind of gives me the segue which I wanted, because the big crux of this conversation is I want to talk about your business, which involves blood test.
Yes. I do. I have a research lab that does blood tests. Yes.
Yeah. You do something called gene expression as well, but I want to save that for another day.
Yes. Okay.
Because that's quite complex and it's something that we'll probably do over a couple of episodes. So first of all, the lab is called Regen. It's in Wangara.
Yeah.
So tell us a little bit about what you guys do, so the services you do and why this is of interest to fitness people.
Well, at the moment, because of my affiliation with the university, I actually service a lot of their blood work. So a lot of the research that I'm in or am involved in are either sports science research or medical science research, where you are looking at using exercise as a form of therapy.
Sure.
For people with chronic disease, for people with cancer, any one of these, or recovering from cancer, and it's found, and I think now it's quite established that it's actually a really good tool. And I think it comes back to what we were talking about before. You know, it sort of helps you to write your insights.
Yeah.
You know, so, but for a lot of the research where you're actually using participants, you have to have an internal marker that's representative of that change. Naturally, you look at blood markers because blood's your transport medium.
Yep.
And that gives you an idea of how the insides are doing in relation to what sort of interventions you're putting them through.
Yep.
So some of the markers, I think the standard ones that you look for, obviously if you're looking at health, are your glucose, your lipids, your HDLs, LDLs, your cholesterols in total. Some cases you do look at VLDLs, which are small, different subset of lipoproteins as well.
Mm-hmm.
Other things you look at as well, especially since it's exercise, you look at insulin levels and sensitivity.
Yes.
Especially when you're looking at exercise in relation to how that then helps with type 2 diabetes, for example, or how well people who are morbidly obese are doing as well, because all of that all has an impact on how efficient your body is functioning.
Yes.
Right? Insulin sensitivity especially.
So you're basically getting a chance to look under the hood to
exactly.
see what's actually going on instead of either guesswork.
That's right.
Or
judging from physical observation of the person alone.
Yeah, which I see a lot now. People will do that. Or someone will just go into a supplement shop and buy something which has no effect of them whatsoever. And so this gives someone an actual snapshot of what's going on under the hood.
Yes.
Now, we spoke about this off camera, but for me, it's silly that that Australia doesn't have access to this. But can you explain why it's hard to get blood tests?
I think that whenever you do blood tests, especially when it is for diagnostic purposes, you have to be careful. And this is what how the medical structure in Australia is set up. It's all about being careful so that nothing's being done just for the sake of doing it. And it's because of that. It's more a matter of err on the side of caution sort of thing, where you do what's required based on what sort of observations you're seeing in your patient, and that's how doctors do it. Mm-hmm. But I think slowly but surely we are sort of moving from a more treating a problem scenario to trying to maintain a wellness scenario.
So preventative as opposed to cure.
Exactly, that's right. Yeah. Yep. So maybe not just yet. I think it's still new.
Yes.
And so it's not something that could be easily implemented in our medical infrastructure. So, like I said, for obvious reasons, because doctors have to be careful with what they're actually requesting patients to get a screen off as well.
Yeah, but you guys being a private lab are able to do this.
Well, I'm doing what I do for research.
Yes.
So, and this is where research is different from diagnosing. Your research, you're at the forefront. You're trying to discover and understand something new.
Gotcha.
Yes.
Okay.
So, and that's why a lot of research projects. That's why you have a lot of research projects. Research projects then help to establish and identify whether or not something's useful or not, and then it moves on to the possibility of implementing it.
Okay.
And so that's the translation process. And I think Australia is in that phase right now.
Sure.
And as a country as a whole, it's a massive undertaking, and so it'll take a while.
Yeah.
And you'll see it exist from a research perspective for a while as a result of that. So for research projects, yes, I provide that service where my lab can actually run tests. It's a PC2 lab, so everything's done properly. It's not a garage.
Yeah, it's actually a facility out at Wangara.
That's right.
So from your point of view, why is it important that someone goes and gets a test?
Well, my opinion, if we sort of look at a particular area, if you're looking at fitness, and everyone now that's trying to get fit, and that's a really good thing that people are trying to get fit. If they've now said, right, I'm going to get fit, and they go join a gym, and they want to say, well, give me the best program you have so I can get to look like you, for example, and all of that kind of stuff. I think sometimes people jump the gun.
Yeah.
Because they first need to understand, and even the exercise physiologists will probably benefit from understanding how well they actually look on the inside.
Yeah.
If you had someone, and you mentioned when you went to the hospital and you had a look at this patient, you looked a bit unfit.
Yes.
Drinking. I mean, would you automatically put him on your best or your most intensive program? Probably not.
No.
But then, so the question back is back to you would be, how would you decide what program to put him under? And this is where, if you understood what he was like, what his functioning was like, his body was functioning like,
yes,
then it makes it easier to say, well, let's start you off with this first, and then there is some method to the madness as far as what programs and what exercises you're going to give him. If he's someone that say, and even if you're talking from a nutrition perspective, you don't just grab someone and say, you want to get fit, have all of these supplements, and you'll be and you'll be fine.
Which is what happens.
Yes, exactly. Not knowing or not understanding what he's already taking or not taking, or what his metabolism is like, or all of these things come into play. And you find that there are people that go in because they've stressed their bodies out too much from too many different sorts of supplements, or not realizing that they could be intolerant to some of them.
Yes.
Or even have an allergy to some of them. So, so that becomes a problem.
Yes.
So that's just from a nutrition perspective. Say likewise with exercise. Exercise is good for you, but don't forget it also provides a certain amount of stress for your body.
Yes.
Because you're stressed from trying to supply what the body needs in order to do the physical activity that it needs. So you're talking about cardiovascularly. You're talking about from a kidney, your kidneys perspective. From your liver's perspective. All of these things. While they're probably functioning well with your everyday stuff, if you now throw in a really intensive exercise, you have to wonder how your body's actually coping with that.
Yeah.
Or if it was because you don't know how well it was coping with your day-to-day stuff anyway. I just came, and not to sound like I'm trying to keep fit, but I just came from the gym yesterday.
Yes.
And this chap that I knew for a while, I didn't see him for a while, and all of a sudden I saw him, and he said, "Oh, how you going, Des?" I said, "Yeah, good." I said, "Where have you been?" And he said, "Oh, well, I've been away." I said, "Where is?" Then he lifted his shirt, and he's had a transplant. His kidneys gave.
Wow.
And he was fit, He was really fit. It was one of those chaps that was always in.
Yes.
And all of a sudden he said, "No, Des, I don't know what happened." All of a sudden one day I felt dizzy, and they had to bring me into hospital, and then I was told my kidneys were failing on me, and so he's got a kidney from his brother now, kidney.
Did he say, is that a genetic thing, or is that
I
extra
don't know.
consumption of proteins?
I don't know. Like I said, there's a multitude of different things that could have contributed or added to that, either singularly or together.
Yeah.
But we don't know. So like I said, so the reality is, I reckon it's a really good idea to find out how your body's doing on the inside before you start to pile on more stuff as well.
So, on that, a pro bodybuilder died 2 years ago, Dallas MacArthur, and he was 25, I believe. He was very young, but he was a young and up-and-coming, promising bodybuilder. Yeah. Now, I did a podcast recently with a good friend of his, Josh Lenardowitz, who's the top Australian bodybuilder, who was the one that found him. So it's obviously something very close to him. Yeah. Now, I spoke to Josh, and he spoke about getting regular blood tests. And one thing he said was, I just wish that he got a blood test because he would have known that genetically he had this issue and he would have been able to prevent it. But because he didn't know, and they were obviously doing things which I believe it was a heart or something. They were doing things that could have been affected from not checking under the hood.
Yeah, absolutely. I can imagine that.
One question I wanted to go back to, you spoke about getting blood tests done and that could change the way that you train. Yes. From a nutrition standpoint, I completely understand that. You know, people have intolerances. They there's obviously things that I understand. From a training point of view, why would a blood test change the way that you would train someone?
How would that change the way you train someone? Because that would, if you're an exercise physiologist and you were about to map out a certain program for someone, because he says, "Look, I want to be this. I want to be like you," and I think a lot of people come into exercise at the start not realizing the amount. It's actually a long dedication. Yeah, they think it's something that they can get over a short period of time.
The amount of people that go into a supplement store and say, "I want protein, but I don't want to get too big," is the first one. Or if there's a guy who's really fit and really big, and they say, "Oh yeah, I want to be like that," that's like, dude, how long this is taking me?
Yeah, but that's just it. It takes time. Let's not even go into exercise first, but let me just on a segue. Just to get your meals right, just to make sure. And when I by saying that, what I mean is having your body accept that you have to eat 8 meals a day as opposed to your average 3 meals a day. Takes a lot of training, not just you trying to scoff food down, but your body to understand that enzymatically that's got to happen as well.
Sure.
So there's a lot of training there as well.
Yeah.
So likewise, I can only imagine, if you're trying to now provide a kind of stress or a demand for your body to grow bigger, be fitter, anything, you really have to be functioning at your top on the inside for your body to be able to accept that training and grow from that training as opposed to suffer from that training.
Yeah.
I liken it to very simply like a car. If you buy a car that's basically a lemon.
Yes.
You can't sort of race it down the stretch and expect it to do its best because the inside, it's just waiting to die.
Yes.
But if you get a new car, the only reason why we probably be able to do that is because the inside, everything is functioning as it should.
Yep.
It's as simple as that. So it's a can I say it's a healthy car?
Yes.
As opposed to an unhealthy car that's got clogged arteries and whatnot. Everything's not working and stuff's leaking and all that kind of stuff. So in other words, it's not functioning from a health perspective. The car's not functioning the way it's supposed to. How can you then put more demands onto it?
Yes.
And people, your bodies are, I think, invariably the same.
Yeah, it was interesting. We did a podcast yesterday with a sleep scientist, and even like incorporating proper sleep and tracking sleeping, just simple stuff like that. What are the common things that you should be looking out for when you're getting a blood test? What are the common things? You did mention other stuff.
I think that first and foremost, if you wanted to see more often than not, when I was working in pathology before. Blood tests, I think normally people have an idea, have a notion that blood tests, you look at a snapshot and then you know what's happening to your body. The reality is a snapshot value of anything, most things rather, they don't really tell you much because it doesn't really give any perspective on that.
Yes.
Really, a lot of tests, doctors, they look at the whole historical process, what you were before and all that kind of stuff. And that's why there are certain tests that would stand out as a snapshot, but not all of them. So things like where people are in a dire situation, like if you have someone having a heart attack, then your CK, your CKMB, your TROP-T, your TROP-I, all of that goes up over a period of time. Mm-hmm. And if you catch those, it doesn't happen for any other reason,
sure,
except if you're having an episode. But if you look at cholesterols, and people tend to go, oh, my cholesterol's really high from this test. You can be healthy now. If you can go grab a really greasy burger, come back, take a blood test in an hour, and it will look shockingly bad.
Yes.
But it's really an indication of what just went into your body. It's not an indication of what you are permanently. So that's one example where you wouldn't look at cholesterol just a once-off. If it is a once-off, if doctors are really, oh, that's really high. Well, let's come back a while later and then look at that again. And he'll ask things like, how's your diet, all that kind of stuff.
Yeah.
Because by that one test, it sort of raises an eyebrow, but that's all it does. And that's why he'll ask, what do you have? What do you have? Did you eat something? And that's why most blood tests are done fasting.
Yes.
Because they want to make sure that you haven't sort of screwed around with it by eating something that you shouldn't have or not eating, and all that kind of stuff.
I think every blood test I've had, it's fasted.
You always do it fasting. Well, you'd be surprised how many people don't follow those rules.
Yeah.
Yeah. So that's one.
Yes.
But the glucose, that's something that you can look at a snapshot, because there is an interval. Most tests have an interval that you deem as normal, and you kind of hope that they all stick within that. For some of them, like glucose, your blood glucose levels, those, your body tries to maintain, a healthy body tries to maintain your blood glucose levels within that interval. And if you're above that in any point in time, that's not a good sign. So that's one example of where a snapshot's useful. So those are some of the tests that you can actually look for.
And then, I guess the most important thing, how can people use this to optimize their health, which I guess is what we want, is a healthy body, so they're functioning properly. So how do they use this to optimize their health and fitness, to become essentially better versions of themselves, whether they're athletes or just fitness enthusiasts?
I think if we have an understanding of what the normal intervals are for things like your blood glucose level, for your cholesterols, HDLs, LDLs, even though HDLs, LDLs, shouldn't really be used as a snapshot. But the idea is, if you were someone that was actively trying to make sure that you were healthy and your diet was healthy and all that, so all of that, those blood tests every once in a while, I reckon, is a good idea to help monitor that internally as well. How's your sugars doing? How's your cholesterol doing? So if you do it frequently enough, it's for you. It gives you a historical chart of how well you're abiding by those rules to make sure that you're healthy.
Yes.
And therefore, how well then your body's doing on the inside as a result of that.
Yeah.
Yeah. So one other marker that people tend to use is your CRP, which is C-reactive protein.
So that's inflammation.
Yeah, that's inflammation.
Yeah.
People tend to use that, the value you get. There is a reference interval as well, but people tend to assume that a high CRP is always a bad. I mean, once you get past a certain level, definitely it's you should go see a doctor. But people forget that exercise naturally causes your CRP to go up as well.
Yeah. So a couple of years ago, I did 12 months of extreme dieting, and so I went through a baseline, a control. Keto, vegan, macros, so 3 months of each.
Yep.
And every time I got a blood test, it showed very, very high levels of inflammation, no matter which diet I was on. But I trained 5-6 days a week doing CrossFit, which is
the markers that your bloods provide you are indicative of not just a singular thing that's happening to your body, but everything.
Yes.
Exercise inclusive.
Yes.
Any sort of stress you put on your body is going to result in an inflammation. Growing muscle is an inflammation of sorts.
Oh, really?
Yeah, it encourages that. And that demand then tells your body, maybe we need more fibers.
Yes.
And that's what it is. Obviously, the more efficient your body becomes in a particular movement or exercise, that comes with you becoming an elite in a particular exercise, that C-reactive protein level starts to drop, because your body's like, yeah, I know what you want to do, and it's not stressful for it anymore.
But then wouldn't you still then need to create more stress to then be able to create adaptation?
I suppose you can use that as an indication, again, of whether or not that exercise is creating enough of a demand.
Yes.
I suppose that's one way of looking at it.
What about getting hormones tested?
Yeah, I mean, definitely hormones you have to test. So I suppose if you're younger, maybe not so much. But I suppose if you're someone that's struggling to see any results in your training, definitely have hormones checked, because your hormones are your regulatory hormones.
Yeah.
Basically, make sure that every other function in your metabolic processes do what they're supposed to do.
Because I guarantee every single guy that gets a blood test will want to see what their testosterone levels are.
Well, I think definitely yes, but I think even within that there needs a bit of education in that. I think that, and this is why I like something like this, because I think it's a good way of trying to get the information that we've garnered from research and science out into the community, so that the education level in community also starts to increase.
Yes.
And people actually understand what it is they are seeing.
Yes.
So when coming back to testosterone and stuff, there is a difference between your fully bound testosterone and your free testosterone.
Yeah.
And that's what you want to look at and try and understand. But you also want to look at that in relation to, say, your thyroid hormone.
Okay.
Yeah, so free T4, free T3s, or your THH, all of these things, because they all work in tandem.
Yep. Okay.
And estrogen levels.
Yes.
Definitely. Because it is testosterone and estrogen. It's a balance. You're talking about a balance that's causing that's permitting things to work the way they're supposed to.
So, so an easy example with that, if somebody uses an exogenous testosterone, so not naturally produced in their body, or if they're enhanced, then the testosterone goes up, except the estrogen tends to follow to create a
because your body's trying to right the wrong.
Yes.
So testosterone, estrogen, they all work on a negative feedback loop.
Yes.
So that it maintains a certain level of balance within the body. So if you up one, the body's going to go, oh, look, we need to maintain that proportion by getting the other one up as well.
Yeah.
That's a natural thing.
So,
and your body's going to shut down your own processes as well.
which seems to be the issue for a lot of people. All right, so one last one on the free testosterone versus bound testosterone. So my last blood test, which would have been over 12 months ago, so well overdue, my testosterone levels were within a lower optimal, but based on Inside Tracker, I was still sitting at the lower level of optimal, but a lot of my testosterone was bound testosterone.
Yes.
Why would that be a case?
I can't tell you. I'll tell you honestly. I can't tell you off the top of my head, but I can sort of look it up. I can't tell you off the top of my head. That's not because it's something that I understand enough, but not thoroughly enough to sort of provide a comment for that. But I know there is a proportion that your body tries to maintain, and the testosterone is used for a myriad number of different things. Before it decides to provide what's needed for all the extra stuff, it has to make sure that your the mainstay stuff is fed properly. And I think that's the gist of how it works. So,
last one. How often should someone get a blood test?
Oh, that's like how long is a piece of string, isn't it? Because for different tests and for different diets and for different exercises and for different things that you put your body through, there may well be different time frames during which something would respond.
Yes.
One example is glucose. That's something our body naturally uses for energy. That's our energy source. But how well your body deals with glucose is the thing that you're worried about. So if your diet is really bad, and what's going to happen is you constantly get a lot of spikes if your insulin is not dealing with it really well. So, I mean, glucose, you can do it. I mean, some depending on what your situation is, some people do it quite frequently.
Yeah.
But if you know your diet, you have a really healthy diet, and that's not something that you have to worry about. So you don't have, you don't add sugar to anything, and you've kept your sugar, your simple sugars to a minimum. Then maybe it's something that you can confidently say it's probably not going to be affecting you so much.
So essentially, like a case by case basis.
It is a case by case. But and like I said, so more often than not, in my opinion, I would. If it was me, I'd do a comprehensive metabolic panel to see what my body's functioning like first. It's like just giving a once through to see what it's like, and then maybe figure out, what are some of the key things that you might want to focus on if that's your problem. Yeah.
And to get a comprehensive panel done, people can just see you, get in contact with Regen. How does that work?
I think maybe contact you, and then you can contact me. That's probably the best way to go about it. Because I think with most tests, it's better to run a whole lot of them. It's more cost effective as well.
Sure. Okay.
Yeah.
So essentially, what you're saying. So with the business, so you guys do like mobile. You can go out to locations if there's groups of people.
We encourage them to come in because there's a space, but we can actually if we can set up a proper space for drawing blood and all that kind of stuff, and making sure that everything's done in a hygienic and sanitary manner.
Awesome.
We have certified phlebotomists that will come out and help you draw your blood and send it back in a proper esky and everything. Get the blood test and give you the results back in a week or two, and that's it.
Awesome. Yeah. Nice and simple. Sweet. Yeah. So we will put out details how to organise that and make that happen. Des, anything else?
That's it for this episode. We hope you enjoyed the podcast. If you did, then make sure you give us a 5-star review on iTunes, Google Play or Stitcher for your chance to win a Perth Fitfam t-shirt, which we'll be giving away at the end of every show. And just remember that if you love what we do, then you can become a supporter of Perth Fitfam by joining our fan subscriptions on Facebook, and you'll gain access to exclusive content, discounts on merch and more. Thanks for tuning in, and stay tuned for more of the Perth fitness scene to come.